really good to be on the ThreeBestRated. We put in a tremendous amount of effort here, really working on ourselves. We want to serve the community, we want to help people. That's the main kind of goal of the whole thing. What are the things needed at each step along the way in order to get you there, whether that's mobility, through kind of continuous text and email feedback. So we tend to send. So within this Surrey community, there's a lot of very hard-working people. So many of our clients are putting in long hours. So the goal of Pure Life Physiotherapy is to do physiotherapy treatment in a better way. There's so many clinics that are around that just do treatment in the wrong way. They use unevidence-based treatments, they use gimmicks, they use kind of pseudoscience, and they're not giving their patients one-on-one time, not giving a clear diagnosis and a clear picture. Pure Life Physiotherapy was created because we believe that we can do things in a better way, the way treatment was supposed to be. So that's active, hands-on based treatment and getting better results out of our clients. So the main values of the owner of Pure Life are service. We want to serve the community, we want to help people. That's the main kind of goal of the whole clinic. Especially right now in Surrey and just in BC in general, there's so few people have family doctors, so few people get proper diagnoses, people are waiting ages for scans and for proper treatment. So we aim to service the community by providing quick access to good physiotherapy healthcare, and we get excellent results for our clients. We get them back into functional things they need to do, get them back to work, get them back to spending time with their families, get them back to their hobbies and enjoyable activities. And that's how we serve the community. So some of our greatest strengths, one of them I would say is that we're holistic. So for example, if a patient comes to us with knee pain, we're not just going to look at your knee. We know there's a real person behind the knee. You have goals, you have things that you need to get back to. So we're going to look at the whole picture. We're going to look at your past medical history. We're going to look at everything above and below the joint, everything that we can in order to get you back to your best. The second thing I would say is our communication and just our culture around the clinic. We really like to take the time to get to know our patients. We really value their time and the fact that they took a chance with us to come and have treatment. And we try to treat them as part of a family and part of our community. So with creating treatment plans, it always starts with the patient first. We need to identify what are the goals and what are the things that are limiting the patient from those goals. Once we've kind of established that, we can put together a plan that lays out, how long is it going to take? What are the things needed at each step along the way in order to get you there, whether that's mobility, strength, reduction in pain, just general functional mobility. So we put all that together and that comes up with a treatment plan in which you kind of have a specific outlook of where you're going to get to. So there's a variety of ways that we track progress. Number one is just simple subjective feedback. So, every session that you come to, we're going to be checking about how things are feeling for you, how are things going day to day, and in general, like that. The other way we can track progress is through our exercise app. We provide exercises that you can also log onto an app and view, and then you can actually log how's the pain with the exercises, how's the movement feeling, and just generally how you're doing. The third way is through kind of continuous text and email feedback. So we tend to send follow-up emails after sessions for patients, and in that you have an opportunity to update us and tell us how you're doing and where things are going. So we offer a variety of resources for the clinicians to keep up with the latest evidence. We provide access to blogs and kind of online forums in which they review certain articles. The staff always has access to that, so they can see what's the latest things changing within the world of physiotherapy. We also provide weekly in-service trainings where we go through, updated treatment techniques, updated diagnostic criteria, and things like that. So we keep everybody up to date. And we also provide detailed in-person training from various specialists that come in and do, days of training for our staff. That happens on maybe 4 times a year. Furthermore, we also do provide access to like online training platforms where you can do a full, say, online course on different specific joints or conditions and things like that in order to keep ourselves updated. So it's an ongoing process. There are several memorable patient stories. One of the most recent examples that comes to mind is a stroke patient that we had. This patient had recently been discharged from hospital, but did not receive good aftercare when they were in hospital. And they were also going to another physiotherapist that they maybe were seeing some results, but they wanted to get more. So they were looking in the community to see what else was out there. We were able to provide them with great advice, manual therapy, and also exercise-based treatments in order to increase their range of motion. We did a lot of balance training, mobility training, and put a lot of time and effort in with the patient. They were really, really happy. They went on to give us testimonials and great reviews, and they've stuck with us for months and months and months as we continued along their stroke rehab. So that was really exciting for me, and I was very, very happy with that. So within this Surrey community, there's a lot of very, very hardworking people. So many of our clients are putting in long hours, doing very, very physical demanding jobs. We have a tremendous amount of nurses, care aides, warehouse workers, longshoremen, and they're doing these physically taxing jobs and ending up with muscle strains, overuse injuries, and different things like that. So these are common things that we see in the community. In addition to that, we have a lack of healthcare. People are struggling to get in to see family doctors. There's long wait times in emergencies. There's a lack of resources available for people in order to get themselves out of pain. And that's where we feel that Pure Life Therapy fits in, because we can actually help people and get meaningful results in hopefully a short space of time. It feels really, really good to be on the 3Best Rated. We put in a tremendous amount of effort here, really, really working on ourselves every single day, making sure the staff is well trained, making sure the clinic is performing well. We generally really, really care about our patients and try to get the best results for them always. We take all feedback seriously, so it feels very, very good to just get a little bit of recognition for that.